Previously on Function First Care.
About when someone is under stress, their stress pathway will steal progesterone. So progesterone is one of our sex hormones, and it's the hormone that helps us to stay calm and, reduces anxiety and helps us to sleep.
Okay, so advice for case managers and healthcare professionals. So this part 5, is all around advice for clinical and rehabilitation case managers like ourselves and healthcare professionals. So on that note, what questions do you think clinical and rehabilitation case managers should routinely be asking female clients that perhaps aren't asked often enough?
Yeah, interesting. I've really reflected on this actually, because because I have not had very many female acquired brain injury clients. Predominantly, they tend to be male, don't they? But I've had a couple during my time, and I probably wouldn't have even thought of the menstrual cycle and female hormone, sex hormones, and how they would have impacted actually on someone's ability and performance. And it was something, as I started to obviously do my own, go through my own journey, and then when I was, obviously gone through various training courses, then it started to, maybe this is something I also need to be thinking about. And even for my male clients, actually, because I did notice changes in their sex hormones, in their testosterone, and how they also responded to stress. So, but I think,
and that's something that's not talked about enough, isn't it? We talk a lot about women's health, but men's hormonal health is really important to talk about as well. Yeah.
I guess because they don't have the same dramatic changes that we do. Theirs tend to be more gradual in essence. So yes, and they're obviously not losing a reproductive function in the same way. So I think I'm not belittling men's journeys, but I think ours can often have a more profound impact. But that doesn't mean men don't suffer and don't have difficulties. But I think what I would like to encourage, so if we go back to the curiosity piece, so for clinicians actually to be curious around hormonal health, potential disruptions to changes in that hypothalamic pituitary axis, which can often happen post brain injury anyway. And so that can potentially impact on someone's menstrual cycle. So are they menstruating? Is their cycle different now? Has it changed? And then, if so, how? So that could be an indication that there is something not quite right. And it might just be a day here or there, but that might impact on symptoms. And so consider symptom tracking. Supporting the client to obviously track any changes in their cycle and in their symptoms, and keep an open dialogue and be curious about that. Consider, if it's an acquired brain injury client, when in their cycle did they actually sustain that brain injury, because that could impact on their recovery. So if you have someone in the luteal phase when their progesterone is high, they're more likely to recover, and that's been shown in research. And they've even started prescribing high dose progesterone post brain injury to help with brain recovery. So it just makes sense, doesn't it? Well, actually, if it's going to help a brain post-injury, it's going to help a brain actually during its menstrual cycle. So that's something to consider, whether or not that would be something that could be useful, progesterone therapy, to aid that brain injury recovery piece. And I think it's also really important that clinicians consider the interplay of menstruation, pregnancy, menopause, with the interplay of co-occurring conditions. And I say co-occurring rather than comorbid, because the general public don't like the word comorbid. I mean, it doesn't sound very nice, does it? But they feel that co-occurring conditions sounds more pleasant, and it makes more sense as well. So, you know, for example, we've talked around, if you have someone, say, with an acquired brain injury, or someone with, you know, chronic illnesses, that their perimenopause or their premenstrual health actually may be more difficult, and they may have a heavier symptom burden, because obviously they've got the stress of the other conditions as well, and some things overlap. You know, if we talk about, say, fibromyalgia, which has a lot of pain, then, you know, you may have a perimenopausal person who is experiencing you know, difficulties with their joints, for example, as a result of you know, a perimenopause syndrome. So I think just having an open mind around, actually, is it purely that co-occurring condition, or could it be something else? And ask questions around family history. You know, did their mother or their aunt, you know, maternal aunt, have problems with their menstruation? Did they have an early menopause? So it's not genetic. It's not a genetic given that someone will have an early menopause if their mother did, but there's, you know, statistically it's more likely that sort of familial incidence of you following in the footsteps of your parent. Asking those questions, having an open mind.
And, you know, women with ADHD, autism, as you've mentioned, brain injury and fibromyalgia, and chronic pain can experience hormonal changes differently. So what should clinicians and clinical and rehabilitation case managers be more aware of?
So they need to understand that symptoms can overlap between traumatic brain injury, neurodivergence, pain, fatigue, mental health, and that these things can result in also, you know, people with neurodivergence, for example, may experience an earlier menopause. People who have had an acquired brain injury are more likely to have menstrual changes or an earlier and more complex menopause. You know, we've talked around PMDD and PMS actually potentially being exacerbated during perimenopause, remember, because of that drop in progesterone. And people with neurodivergence may experience PMDD and PMS as well. They tend to sort of sit in a similar pot of you know, co-occurring conditions. So there's often an overlap, and it might not necessarily be that it's just one thing. There may be other things that are playing into that picture.
Multifactorial.
Absolutely, thank you for that one. And and the chronic stress of all of those things. So, you know, if you're living with, say, ADHD and an acquired brain injury, often they can go hand in hand. You know, you're living in a chronic stressed state quite often, and so remember, that is going to amplify symptom burden for PMS, PMDD, other co-occurring psychiatric conditions, you know, because often anxiety or depression can also sit in that bucket. So it can be really challenging for people, and I think we just, as clinicians, need to have a really open mind and be very non-judgmental, and just help our clients to be detectives of their own wellness, because often they know themselves what is causing what.
Yeah, absolutely. Yeah, we are the experts of our own of our own mind and body, aren't we? So
Absolutely.
you actually had a couple of books that you shown me around
Oh yeah.
ADHD and autism. It'll be great if you can show them.
Yeah,
Yes.
so these are new books that have only recently come out in the last sort of a few weeks.
Yeah.
So I haven't had an opportunity to appraise them myself yet, but this one is Autistic Menopause. And that's by Dr. Rachel Molesley and Professor Julie Gamble Turner. So obviously, you know, very highly esteemed in you know, their specialisms. So yeah, so that one's on, and this is the only one available at the moment on autism and menopause. And this one also has recently just come out, and that's menopause and ADHD. And this is Dr. Helen Wall. And again, I haven't had an opportunity to appraise it. So I'm obviously suggesting them. They are esteemed doctors. They know their source. But I can't give my opinion on them quite yet. So they're on my
well, thank you for showing them.
yeah,
you know, and we'll
and
include
again,
them
this
in
is the only one on ADHD and menopause. So I think
it's good that there are books now and resources available. No, thank you for that. We'll put them on our list of resources for people to be able to access. Speaking of resources, if you were mentoring a newly qualified clinical and rehabilitation case manager or an occupational therapist, what advice would you give them about supporting women more holistically?
And even not just newly qualified. So I do provide supervision and mentoring and leadership coaching for people setting up their businesses or working in this space. And I just want to really reinforce, like, as OTs, one of our secret sources, because we have many, but it's about acting as detectives with our clients, you know, not on our own, co-working with our clients and helping them to problem solve. We are the queens and kings of problem solving.
Absolutely. And creative ones as such.
Absolutely. I think we're incredible, and we're born like that. We're not made. I think it's like one of our innate special
superpowers.
Yeah, absolutely. That's the word I was looking for. You know, and I think one of the things that I've learned over the last couple of years, because I always thought that I needed to know everything, and actually whether this is because I'm now postmenopausal, I don't know, and I am now enlightened, but I think it just comes from experience as well, and just being there and listening to our clients. But I think we need to realise as clinicians, no matter where we are in our journey, whether that's newly qualified or, you know, I'm 34 years qualified, that we don't need to have all of the answers. We don't. And, you know, it's about being open, really listening, hearing and holding space, and everything else will fall into place. You know, you can get the mentoring from someone who's ahead of you, like me, and go and ask the clinical questions, etc. You know, because we all want to have that knowledge, but our clients will guide us if we truly hear them and hold them and nurture them. They will provide their own answers.
Yes.
That's the power of a good coaching relationship.
Yeah, I love that. Yeah, if you provide like a psychologically safe space for somebody that, you know, the answers come automatically, don't they? So yeah, it's really powerful, absolutely. And coaching, that's what coaching is, like supporting individuals to get the answers, you know, to get their own answers.
Exactly. I think that's the one thing that I really took away from my coaching training, because there was always that pressure of, oh, I need to know everything. Well, actually, no, you don't. Yes, you know, I'm a lifelong learner. I mean, don't get me wrong, I'm always doing a course of something, but you know, that's for my own cognitive stretching and learning, and also being able to bring other things to my treatments. But but ultimately our clients are really blooming special.
And the thing is, like, everybody is so different that you can't have a prescriptive, you know, this is what will work for you. Like, no matter how much we learn, and I'm similar, I'm a lifelong learner. And you will always find me on like a course, training,
Yeah,
webinar, like
yeah,
continue, really, really dedicated to my continuous professional development. And the more I know, the more I learn,
I know what you're going to say.
the more I learn, the less I know. Like, I'm like, oh my goodness, like I need to keep
But that's
going, keep going.
because you're a
But
humble practitioner, and I think that's so important, isn't it? To not feel like, you always know more than your clients or more than the next
mm,
person. It's like, you just, be humble
mm.
and, just
I
nurture.
love learning. I
Just,
love learning from everyone, and I think, like the biggest teachers are our clients. And in my relationship with my partner who's got ADHD and autism, he's been my biggest teacher, actually,
mm,
in that space that I now have gone on to specialize in. So I really think you can learn so much from so many people. And so,
yeah.
like you said, if you're really actively listening to someone, and creating and fostering that nurturing space, um, you know, magic will happen.
Yeah.
Honestly,
It's always
it's
about being
beautiful.
open, isn't it? Open and
Absolutely.
receptive. And
Yeah. Yeah, absolutely. So now, part 6 of the podcast is about how you function, because obviously this is Function First Care podcast. So we can't finish off without talking about how you function. And, this is all about, the podcast is really, it loves looking at exploring the person behind the profession. So I love to really get personable with my guests. So a central theme, like I said, of this podcast is how professionals function themselves. What does a typical day and routine look like for you?
it probably looks really boring to people on the outside, but but for me, like, I always start my day with a dog walk. So if you've got a dog, then you have no choice but to get out of the house.
Mm,
You've got to move. But it I tend to either walk down by the sea, or we've got a nature reserve right on my doorstep. So I tend to go and walk there, and I'm looking at the trees, and I'm looking for squirrels and rabbits, and that just really helps to ground me. And I
mm,
talk to people, if we think about that polyvagal theory and social connection, so you're obviously meeting other dog walkers.
yeah.
So a walk is a non-negotiable. No matter what
Mhm,
the weather, I have to get
mhm,
out with the dog.
yeah.
And then when I come back, I give him his breakfast, and then I'll do some exercise after I've done a walk. So I feel like, well, the walk has warmed me up. And then
Yes.
it's usually some kind of gentle exercise. So which incorporates like nervous system regulation. So there'll be some breathing incorporated. So that's either some kind of Pilates, or I'm currently training in Restore Your Core, which is a movement-based exercise program that it's like a blend of yoga and Pilates and nervous system regulation all in one. And
Oh.
I don't I mean, Pilates comes very close to this, but
Mhm,
I come off my mat and I feel like I'm floating,
mhm,
I but grounded back in my body and relaxed. But and I also feel like my body's had a reset. And so yeah, that's been really powerful practice that I've been doing for about the last 5-6 weeks.
mm,
um and yeah, with a view to being able to provide that modality with my clients.
mhm,
And sometimes I'll do some strength training. It's not my preference now that I found this other practice, but
mhm,
so after I've done that sort of movement based practice, which is about half an hour. I'll then have a protein enriched breakfast. So it's all usually a cooked breakfast, which is like some mackerel and some eggs and some salad, you know, for fibre. I never ever skip meals. I do not function well without food. And then I'll have obviously client appointments, and I always make sure that I've got time in between appointments. So my appointments can be quite intense. So if I'm seeing people in clinic, they're 2-hour appointments. So I'll always give myself an hour and a half to 2 hours between my clients. So I'll have one in the morning, one in the afternoon. And obviously my online appointments with people are shorter than that. So but yeah, always make sure that I've got time for myself in between to hydrate and to re-energize and ground myself. And then often another walk in the evening with the dog in this weather. When it's bad weather, my husband does it in the evening, but because after in the morning. So yeah, everything for me really now, you know, I talked about like my busy badge of honor. Now I don't feel the need for that whatsoever, and my priority is always balance and nervous system regulation. So
I love that. That's so nice. And I know you you live by the sea as well, which really nourishes you, doesn't it? Yeah, that's
the
really
sea's
nice.
just amazing because it obviously it's giving off negative ions that helps to ground us, calm us. And you know, even if I'm not walking right on the coast, you know, I can see the sea from where I walk. So
absolutely,
you know, got that benefit. Like, and we're near the woods, we're next to the nature reserve. Like, I'm so fortunate where we live here in Kent. So I'm in Whitstable, if people didn't know, I didn't mention that earlier. So I'm very, very fortunate to live where I do, very privileged, really.
And your clinic, you mentioned clinic, is that where is that based when you talk about
in my
clinic?
home? I have the most beautiful studio in my garden.
Oh, lovely.
Yeah, it's incredible. So my commute is very short. Garden.
Love that. Oh, that's really nice. And do you have any other hobbies? I think pottery was one of them. Is that right?
Oh, my pottery! I love my pottery. Yeah, a little bit of a backstory. So, I mean, purposeful activity has always been really important to me, and you know, trying out different things. And you know, years ago, I loved sewing. And anyway, it was about 2 years ago, and I'm saying this to people because I think it's, again, it's another vulnerable moment, because as we age, and because I work from home, and my best friend died as well.
Oh, sorry to hear that.
Yeah, it was eight years ago, and yeah, it's, you know, your life changes, and I was becoming really quite isolated. So it's good that I get out with a dog and I talk to people, but obviously they're not you know, special relationships.
Yeah.
So I was like, okay, what can I do to change this up?
Yeah.
And so I started going to a different craft every month. So I would try something new. And I went to art classes and, you know, different types of painting techniques, and tried lots and lots of different things. And I did that for a whole year. And partway through that year, I went to a ceramics workshop. And I did some hand building, and then I went back and I did another one, which was on the wheel. And I loved working with the clay. And for a perfectionist, it's a very difficult medium to work with. And I've had to learn to let go of the outcome, because at any point in the process of working with clay, it can go horribly wrong. You know, it can collapse, it can crack, it can explode in the kiln. You know, the glazing can ruin it. You know, literally, and it might not look how you anticipated that it was going to look like. but yeah, so I managed to get a place on an evening class with the same tutor, and I've been doing that for about 2 years now, and it just really helps my mental health. You know, it helps me to be focused, to be mindful. It's just like amazingly powerful. So yeah, I definitely recommend it, and it's been beautifully sociable as well, and I've made some lovely friends there, and we're all crazy about pottery.
Whenever I think about pottery, I'd love to do it with my partner. It's on my list to do, you know. I think about, was it in Ghost? You know, is it Patrick?
Yeah,
the romantic, you know. So I'm gonna like, you know.
I don't know how romantic it is really, because you just make a mess. But
it is the film Ghost, isn't it?
Yeah, it is.
With Patrick Swayze or Swayze? Is that how you pronounce his surname? Swayze, yeah. And I always think about that moment, and like I'm gonna like try and recreate that moment with my partner to try and see if it's as romantic. Oh, that's really nice. Have you made anything like, you know, special from the pottery? Like
well,
interesting.
I just gifted my granddaughter, because she also is the joy of my life. It was just her first birthday on Thursday, and so just a couple of days ago, and I made a jellyfish lamp shade.
Wow.
Had to incorporate some jewelry working elements into that as well. So that's probably the most complicated piece that I've done today. It was quite challenging. I poured a lot of love and effort into that.
Wow, never heard of that being made. That sounds very intricate with pottery as well. Wow. That sounds amazing. So yeah, leaving employed work was a significant decision that you made. What have you learned about designing a working life that supports your own health rather than depletes it?
I mentioned about my busy badge of honor. Like in the early days of like my business and still doing active case management work, like I was so busy, and obviously in quite a stressed state at that point still. And I just put such a lot of pressure on myself. But now, as a recovering perfectionist, I mean, I don't know how recovering I am. I'm working on it. I'm a work in progress. But now my priority is myself. Like, you know, my work is obviously really fundamentally important to me and who I am. And I'm proud of the service that I provide my clients. But, you know, I don't work 6 days a week anymore. I don't work in the evenings. I make sure that my appointments are spread out. You know, we've got to focus on our own self-care.
Absolutely, yeah.
You know, how can we give to other people? It's just
So
impossible. You know, you might be able to work at that level for a short time, but you will burn out and you will make yourself ill.
Yeah,
and the best therapist.
Yeah, and you know what? I was talking to someone recently about how there is some expectation in some corporate sectors where, I mean, whether it's corporate or not, where they have to work crazy amount of hours. I mean, like hundreds of hours a week. I'm talking about.
Culture is awful.
Yeah, and then I mean, but that is kind of like an expectation to work in certain organizations. If you want to make it, you know, and be successful, you know, and reach a certain level of like status in you know, later on in your career, is deemed normal to go through this kind of this stage, like in early stages of being a junior in your career.
I've experienced it myself in some. I won't mention the hospital. You probably would, if people looked, they'd be able to find where I worked. But I worked in a London hospital, and the culture was just like that. You know, they dropped the newbies into the very pressured, you know, ward roles, and just it was sink or swim, and it was awful. It was just the worst place I've ever worked.
And it doesn't, you know, when that culture is there and when you're expected and when your manager's doing it as well, it's like when that culture is created and when it becomes a norm, well, I don't think that's normal for our health and well-being at all. Like,
Shouldn't be
you know,
normal. It's so
no,
unhealthy.
it shouldn't be normalized in us in society for us to in order to progress in our careers to have to go through this period of sacrifice where you're basically just working like literally
A
non-stop,
Trojan. Yeah.
and then you're not functioning during that period because you have, and then you it's like basically there's already an awareness before you even go to that role that okay, this is what's expected of me, so I'm going to fit
Yeah.
into this mold because and just get on with it because
Yeah.
because then it'll become easier. But then really and truly, you know, using my wise mind, I was thinking, well, actually, does it actually get easier? Because you're then responsible as a head of for, a number of individuals, like, and you've got like a lot of responsibilities. So does it really get easier? Yeah, you might be delegating, you're not sacrificing, but then
You
you're
got more
gonna
pressure.
yeah, more pressure, and then it's like you're perpetuating that cycle to carry on because okay, you're now in a head role, but and yeah, you might have purpose and meaning in your career, but then that cycle is perpetuated and it carries on because juniors, where you were once before, have to do the same thing in order to get to
Yeah.
where someone is like where that person is now in terms of like being ahead of and having managing several individuals and yeah, having delegate like being able to delegate tasks, but still you still hold a position of significant responsibility. So then I do wonder, you know this is this is what I've observed in as a vocational
Mm.
rehabilitation practitioner, an occupational health practitioner. I can, I see that people are actually stuck in this system, in this what I see actually as toxic,
It is
and
absolutely. And the
it's
thing
not
is,
conducive
that has
to our health
to,
and well-being. It has
not
to
at all.
change. It has to change. It has to.
Yeah.
And when you were speaking about putting your health and well-being first, having breaks in between, really like being mindful of what your routine looks like, that is the way we should be designing
Yeah.
our work life occupational balance with health and well-being as a priority, and everything else has to work around that. Not that we are putting into these systems and we have to, it's like a pressure cooker. We have to function like we're made to, it's like it's like fight or flight, kind of. And this is what happens with our nervous system. It is in a state of fight or flight, and that's why then burnout happens because it's not normal. Our bodies are not designed, our mind and bodies are not designed to go through that, and I just find it not conducive at all. And I think like, leaders, HR, occupational health, stakeholders that like um have influence to design these systems, they have a real responsibilities, to actually shape these systems with health and well-being at the forefront of everything that they do. From policies to procedures to ways of working to flexible working. It has to be shaped around people's health and well-being, and everything we've discussed today, about bringing in clinicians like ourselves that really understand
Mm.
the person, the environment, and the way people perform as a result, and that biopsychosocial plus soul model, that you talked about earlier. So yeah, so from just closing off, from your perspective, what is currently working well within women's healthcare, and where do you think women are still falling through the gaps?
I'm not sure that it is working well at all, Danuli. Actually, I think the system is broken. Most women are waiting a year to be seen by a gynecologist.
Mm,
I've heard in some areas people are even waiting 18 months to be
mhm,
seen.
mhm,
Um, I think it's often a postcode lottery. So we've got, say for example, my GP surgery. I'm fortunate we have menopause nurses there.
yes.
They've got quite a slick sort of referral process.
Mm,
Um, but there are long waiting lists for pelvic health therapy. Mental health services. Most places have been reduced to 6 weeks of CBT, which doesn't suit everybody and isn't necessarily, that practitioner may not be aware, for example, of menopause and how that can impact on someone's mental health and anxiety, etc. So, I think we've got a long way to go in terms of being able to provide the education and the lifestyle modification support to help people with long-term conditions, or to even prevent those long-term conditions. I contacted my local GP surgery, and the main GP who sort of heads things up, he was like, apparently, he's the lifestyle medicine guru. And they'd been talking about how it would be great to have a program at the surgery, but they don't have any money to pay for it. So what does that say? It's like everything's about, they get money for putting people on statins and people on diabetes medication, etc. But there's nothing for this sort of lifestyle support piece that is essential. We've been talking about.
And actually, if they had that in place, you would find probably the waiting list would be reduced.
Yes.
It would be more cost effective because people will be getting the help that they need.
Less burden on GP appointments.
Yes, absolutely.
They've been empowered to look after themselves, and they're less likely to have long-term health issues as a result.
Yeah, absolutely. And I think this is why it's I really believe that having like private independent practitioners like ourselves who can make private healthcare accessible for people wanting that support is so important. It's so important to have independent practitioners making healthcare accessible, when you have these systems in place that are simply dysfunctional, and just too much pressure in terms of the demand. It's good that we exist to alleviate that pressure, but I do think the ideal, the optimal would be for services like ourselves to exist within these systems.
Absolutely. We should have occupational therapists. I've always said we should have occupational therapists almost triaging people as they come through a GP's door.
Absolutely.
Because if everyone was provided with appropriate lifestyle intervention support, whether psychological and all of those domains that I've talked about today, actually, if we're able to help, that doesn't mean that people won't necessarily need medication, but actually, if we are triaging them and supporting them and educating them, then they're going to be empowered. They might not then need the GP, or they might not need medication, or actually they might need less, or but we definitely need to have OTs in GP surgeries.
And I'm aware that this does exist in primary care, but we need more of
not
this.
everywhere, but not everywhere.
That's true, not everywhere. It does need to be
postcode lottery, and it depends on whether or not a GP prioritizes bringing an OT on board. And I guess because we have such a vast area of expertise, I could very easily see, OTs ending up being falls clinicians, or, just working with a pocket within a GP surgery. So maybe what we need actually are multiple practitioners that can work in different specialisms, because one person certainly can't do everything, for a demographic area. So, but I definitely do think that there needs to be more of us.
Absolutely, no, I think that the healthcare system would be so much more efficient if that was the way that it was
designed. We were utilised as in the way that we're always intended, to work on people's activities of daily living and purpose qualifications, and improving mental health and functioning in everyday life, you know.
Yeah, absolutely. Yeah.
So
Because
much.
what's happening, you know, you get, yes, you have the social prescribing, and you have like you know, like OTs working in acute settings, and then post discharge like inpatient rehab and also in the community. But if we had that piece around, like you said, the triaging, and really there
Yeah.
within GP practices, and then like GPs could say,
Mm.
okay, you've got this difficulty. For example, you know, ADHD and autism, like they'll be signposted to get a diagnosis, but actually not only are they on a waiting list for a very long time,
Yeah.
but also then they're not managing and functioning with their day-to-day function. And then when they have the diagnosis, the post-diagnostic services are limited.
Yeah.
So actually they're waiting a long time on a waiting list to be diagnosed. And then afterwards they've got, you know, this diagnosis, and the support thereafter is
Yeah.
limited, you know?
And in the meantime, actually, OTs could be working with people to identify strategies and ways of, you know, improving their day-to-day routines and habits and all of those things that are impacted by ADHD. And they don't need to have a diagnosis to work with an
No,
OT.
you don't. No, you don't.
So
Exactly
there's
the
so
same.
much that we could be doing to actually support people and also support them in that process leading up to the assessment, which in itself is
Absolutely,
very
yeah.
stressful and very difficult for them to complete on their own. They have
Absolutely.
lots of questionnaires to do. And
Yeah, yeah.
so,
Form
yeah,
filling. I know
we
it's a
just need
bugbear.
OTs everywhere, don't we? We just need to
Yeah.
take over the world.
Absolutely, yes, absolutely. So the more awareness we can raise through, you know, portals like Function First Care and other avenues, to really raise awareness of how, you know, amazing the skill sets of occupational therapists are in the healthcare system, you know, preventative healthcare, you know, and general sort of healthcare, you know, overall, then yeah, the better, right? That society will be, and people's health and well-being will be, and the less burden that, you know, society will face, the less that people will have to, you know, depend and rely on welfare systems. And you know, so you know,
Yeah.
if someone listening today recognizes themselves in this conversation, where would you encourage them to begin?
I guess it depends on what they need support with. Most people would probably start with their GP.
Hmm.
I mean, certainly if we're talking about menopause and pelvic health, which are obviously my specialisms, then most people will visit their GP first. Or obviously their menopause nurse if they're wanting to go down the route of HRT, hormone replacement therapy. Or seek out a professional like me, like you know. Oh, there are lots of occupational therapists that have obviously different specialisms, and we have Find an OT on our Royal College of OT website.
Yes.
You can find an independent practitioner there. So yeah, don't suffer in
And we
silence. It's
and we
asking
are.
for help is important.
Yeah, and it's about raising, again, going back to raising that awareness. We are medically trained as well. So, you know,
Yes.
not just medically trained, but we're trained holistically in mental health, learning disability, physical health. And, you know, we actually learn about holistically. And when I talk about holistically, it's everything down to someone's spirituality, you know, cultures. Like we really look at the nitty-gritty of someone's life, in that
Absolutely.
biopsychosocial plus soul model,
Yes.
you know, that you spoke about earlier. So,
And I
if you
think
could,
that's a really important point because
mm,
the world is being flooded
mm,
with coaches, and I don't want to denigrate coaching. I have trained in coaching myself, but I think it complements what we
mm,
do as occupational therapists as
mhm,
opposed to replacing it.
mhm,
And I think what whoever you choose to work with, check their credentials,
mhm,
check who have they done their qualifications with,
mhm,
and make sure that, because coaching isn't regulated, whereas allied health professionals, we are regulated by the government, We have to pay to be registered, and we have to be part of a professional body. Coaching doesn't have any regulation. And there are people who act as coaches who have no qualifications whatsoever. So I think the fact that we as allied health professionals, as you say, are completely holistic, but we bridge the gap between medicine and other things, you know, we're the glue, aren't we? Because actually we know a lot about a lot.
Absolutely. Yeah, you're right. You're absolutely right. And it is that whole, you know, biopsychosocial model, isn't it, that I see now coming a lot into the medical world, because they're now thinking, oh, like we have to think about not just the medical side of things, but we have to think holistically, you know, like just like how we're trained. And yeah, we are a regulated profession. We're regulated by the Health and Care Professions Council, so the HCPC, who are a body that regulate health and care professionals like occupational therapists and other professions.
And our training is a minimum of 3 years. So,
yes,
you know,
and we do 1,000 hours of placement hours, clinical hours in placement settings. So we train really hard for, you know, and we've existed for 100 years as a profession. Yet, no, you know, there are still, you know, people who are unaware of what occupational therapy is. So yeah, my mission is to make sure everybody knows what occupational therapy is at some point. So yeah, if you could actually redesign women's healthcare from the ground up, placing...
I think I've probably already answered that, really. I'm just, OT, take over the world.
From the ground up. Yes.
Sorry, getting all excited.
Placing prevention, like, you know, if we could redesign, yeah, we've talked about it already, but briefly, if we could, you know, redesign women's healthcare from the ground up, placing prevention, function, lifestyle, and nervous system regulation at its heart, like what would that look like in a nutshell?
It looks like my PLC.
It looks like, I love that.
That's what I do, isn't it? So yeah, maybe we just need to send my model out into the world.
Your domains, I absolutely love your domains, your 14 domains. Yeah, by the way, again.
Well, I think, you know, in terms of, like, we should be positioned in women's healthcare. And again, it's that because we're bridging the gap between medicine, physical health, and mental well-being. Because in pelvic health, and well, in all of women's health issues, obviously we've talked about lots of different conditions over our podcast, and I think there is a huge emotional and psychological component to the experiences that women have in relation to their pelvic health, particularly in those pelvic health conditions and hormonal health conditions. So, you know, we are trauma informed. We are able to support people psychologically. If I could maybe mention a brief story of, I went to have some pelvic health therapy myself with a different allied health profession, which physio predominantly. That's what, if you go to see a pelvic health practitioner, that's what you'll see in the NHS. They currently don't recruit any other professionals. And she was,
why aren't they recruiting occupational therapists?
They should be, but that's historically, it's been physio who've predominated in this area, and actually they have a shortage of physios. So I see
this in occupational health as well. You know, carry on.
Yeah, it's fine. It's been a difficult journey, and during
Tracey, sorry,
yeah,
you froze there for a moment.
so did you, but you came back straight away, so I didn't think.
Oh, right, okay.
So explaining that I was having an internal examination, an intervention, having a treatment, and I became emotional, and the practitioner sadly said to me, "Oh, do you think you need to see a psychologist?" In the middle of that intervention. So she was in the middle of treating me, and she didn't know what to do or how to hold my emotions in that moment.
And this was a physiotherapy provider.
Yeah, it was a private treatment. But I think that's what we can do as occupational therapists. We can support people with that psychological element, you know, the trauma-informed support that other clinicians aren't necessarily trained to provide. And there's no reason why, as occupational therapists, as long as we've had the training, then it is within our scope to provide internal examinations. So I'm trained to do that. So, you know, I'm not saying that I know everything. I'm still learning, and I'm open to learning, but I know a lot, and I'm able to treat women in this space. So I think, I don't think
that, because also there's so much you know, that people that, you know, I didn't know that until I met you, that was possible, you know, to do as an occupational therapist. And actually I've learned a lot from you, that, you know, if I don't know myself as an occupational therapist, you know, how are we expecting the population to know this as well? So this is why
I think the power of occupational therapy in terms of that whole person approach to care is often and it's often underutilized, isn't it? In a lot of places, you know, we're pigeonholed into working in specific ways or specific sort of generic roles, and I think we've got so much more that we can bring to the table. Definitely.
Absolutely. Yeah. And finally, what does functioning well mean to you, and what message would you most like women and healthcare professionals and the healthcare professionals supporting them to take away from today's conversation?
Crikey, I think there's a lot, isn't there, that we've covered, but I think for me, functioning well may be different to you or the person next door. So it's got to be an individualized conversation and approach.
Yeah, absolutely.
And not a one size fits all. So for me, going out, doing a walk, come back, doing an exercise, eating my breakfast, that isn't going to be everyone else's cup of tea. So we need to ask people, what is it that they want? What are their priorities? And what do they want their lives to look like?
Love that. That's
keeping that person at the center of the conversation.
Love that. Thank you so much, Tracey. And there was some other books that you had that you wanted to share, wasn't there? So
yes,
I would love to see that before we wrap up.
Yeah, I've showed you the Laura Brydon ones and the PMS Bible. For those that are interested in a little bit more of a less mainstream approach, I would say, or want to discover more about progesterone and rethinking estrogen, then I recommend Balance Matters by Kitty Martone. She's the healthy gut girl on social media. And she's very much about sort of natural processes and utilising progesterone therapy. And then a little plug for myself. So during lockdown, and this book is still available, so I co-authored this book with another, there were 10 of us, so another 9 practitioners. During lockdown. It's called From Surviving to Thriving Unlocked. And I wrote 2 chapters, and one was on sleeping soundly, and the other was about finding balance in an unbalanced world. But
Wow.
even though we wrote it in lockdown, there's lots of gems for living well and nervous system regulation and things. So that's available on Amazon.
Wow. And what were the backgrounds of the other
All different.
people?
So some of them are coaches, a nutritionist, wellness consultants. A friend of mine also contributed, and at the time she had a food business, and it was all about sustainable eating and things. And she talks about losing her daughter, who was premature, which was really sad, and that was during lockdown. So that was a pretty tough.
Yeah, sorry to hear that.
Yeah, and then I've just got one more plug.
Yeah.
So as part of my retreats that I've ran, but these are independent, standalone, I created 4 reflective journals, so one for each quarter.
Love
They've
that.
all got a different sort of, cover theme, but inside they all are the same except for different colouring pages. So it's full colour. So we've got it's not just a standard sort of journal. We'll try and find. So this is the balance wheel, which is really good. So it's all about doing, being, becoming, and belonging around Wilcox theme. And there are questions to help people think about what is it, to have that balance in their lives. What is it that they really want, and set some goals for each quarter. And make sure that they're having balance in the important domains in their life. So there's a mixture of space to write short answers, sort of end of week reflections. There are some really lovely colouring pages.
Wow.
Well, so
Beautiful.
yeah, it
really
took
nice.
a lot of love to curate.
Yeah,
so you'll
that's
find
so
those
nice.
on Amazon as well. So there are 4
I
different.
love that. Yeah, I love that. I'll be getting my hands on that. Yeah, no, that's so nice. Thank you so much. Well, you know what? I've absolutely adored like spending time with you. We
Been
spend
amazing.
we know each other, in and out now.
Yeah.
And yeah, it's been an absolute pleasure. And would love to have you back on Function First Care in the future. And if anybody has got any comments, like anything they want to know more of, then obviously they can use the comments section. And we will, and Tracy is kindly going to provide like resources, links, and her contact details to get in touch with her service. So yeah, if you like this podcast, please give it a like and subscribe to the channels, and and kind of follow the socials, for all the reels that are going to be there with Tracy and other guests. So yeah, thank you so much for your time, Tracy. It's been absolutely amazing having you on Function First Care podcast. I hope you've enjoyed it.
Oh, it's
And
really interesting. Thank you.
yeah, no, thank you so much. Really, really appreciate your openness, vulnerability, and yeah, your willingness to share your lived experience. Like, absolutely loved every moment. So, thank you so much. Yeah, and for teaching us about the anatomy of the pelvic system. Absolutely love it. Thank you so much, Tracy. Take care. Yeah.
Yeah, bye.
Thank you. Bye bye.